The World Health Organization says that 1 in 4 teens in India, that is meaning people in the ages of 13 to 15, have depression. Every hour, one student commits suicide in India, according to the data that's compiled by the National Crime Records Bureau. So today we are very, very grateful to have world-renowned child and clinical psychologist Dr. Bhavna Barmi with us. I want to kick it off with, as parents, I mean, we're very worried about this. We read this. So what should parents look at, and what are the signs that they should look for?
I want to start with something that a lot of parents may not know, that it is also related to a mental health concern, which is ADHD. A lot of people talk about it in times of today. ADHD is an Attention Deficit Hyperactivity Disorder. So inattention manifests behaviorally in ADHD as wandering off tasks, lacking persistence, having difficulty sustaining focus, and being disorganized, which parents actually perceive as being due to defiance or lack of comprehension in their children, which is not true, such as a child running about when it's not appropriate, or excessive activity, fidgeting, tapping, talkativeness, again, which is misunderstood. So some things that parents need to be aware of for ADHD is when a child often fails to give close attention to details or make careless mistakes in schoolwork or during other activities, or has difficulty sustaining attention in tasks or play activities, they need to be vigilant. And often children also blurt out answers before questions or talk with a lot of interruptions, is when we know that the child may be going through something called ADHD. That is one of the things I want parents to be aware of. Second thing commonly seen in children is SLD, which is a specific learning disorder. Now, again, learning disabilities are very, very commonly seen but misunderstood. Certain types of SLDs, and for which even CBSE and our government gives you leeways, certain types that we need to identify whether any of our children are going through is, one is called dyscalculia. Dyscalculia is a SLD that affects a person's ability to understand numbers and learn mathematical facts. Dysgraphia is a specific learning disability that affects a person's handwriting ability and his fine motor skills. And very commonly we see dyslexia, from the Tare Zameen Par to a lot of us being able to diagnose it now, because that affects reading and related language-based processing skills. Another thing that you very rightly pointed out is depression. It is so unfortunate that a lot of children, and the statistic that you shared is so challenging, that they go through such sensitive conditions at such young ages.
Now, Dr. Bhavna, a lot of parents I hear are very confused, because is the kid just being a kid? Is he being rebellious, or is he actually depressed? So it's very hard to figure out. And how can a parent actually figure this out if they think that maybe the child does have depression?
If the child is having mood swings that are being triggered by certain things, then it is not a clinical depression. Then what do we need to do is we need to understand what is the trigger, what is the stress, and once that is dealt with, you will find respite in more emotional stability. But when this mood swing usually wavers towards feeling low, feeling sad, not feeling interested in pleasurable activities, having a disturbance in sleep, having a disturbance in appetite, and these symptoms are persisting for more than 2 weeks, is when the parent needs to get formal evaluation.
Now, a lot of talk, especially about social media and the ills of social media. And it is often said that this is actually affecting teens far more seriously, because they're constantly, their whole life, their circle is just surrounded. What can we do about it?
See, the first very important aspect is that you be the role model that you want the children to follow. A lot of us actually as adults, as parents, use so much of gadget, use so much of screen time, that first we need to moderate it. Secondly, we need to inbuild a constructive schedule for our children, especially our teenagers, which is as productive or as pleasurable as what they get out of the screen. So to be able to limit it, we need to actually give them something which is different, which they can do, and which is of even more value to them. So start accepting your child. Start accepting your child with the strengths and his weaknesses, and start inculcating what can he do, which could also bring about a lot of pleasure to them. So create opportunities. help them enjoy life, create cherished moments, mentor them. Because a lot of times when we have a good connect and when we could get good social connects around them, they themselves would go away from online and screen times.
Thank you so much, Dr. Bhavna.
My pleasure. My pleasure.